Hello and good morning. My name is Jeremiah Shaver and I'm a multimedia journalist with The Telegram. This morning here at Holzer Medical Center of Jackson, there was a special ribbon cutting and some guest speakers that spoke about a $20 million mental health study that will be taking place here in Southeast Ohio. We were here to cover it all, so we're going to tune in and listen to what this study is all about.
My name's Lori Cremines. I'm the Vice President of Operations here at Holzer Jackson. We want to thank you all for joining us today to celebrate this very important milestone for the state of Ohio Adversity and Resilience Program, otherwise known as the SOAR Study, with the opening of the mobile MRI unit here in Jackson, Ohio. We're very honored to be able to collaborate with multiple agencies to offer these services to our community here in Southern Ohio to learn more about mental health and resilience. We have several speakers today that will share many aspects of the program and the benefits that it will provide. Again, thank you so much for taking time out of your day to show support for the SOAR study. Without further ado, I'd like to introduce Dr. Rodney Stout, our CEO for Holzer Health System.
It is hard to believe that Holzer has been providing health care in Southeast Ohio for over 100 years. And while you won't find research in our mission or vision statements, we do have a long history of supporting research. Prior to my role as CMO, Chief Medical Officer, and CEO, I served as our Director for Clinical Research. We served as a regional site for many pharmaceutical studies, including several of the diabetic drugs you now see advertised on TV. We also have a proud history of partnering with The Ohio State University in a number of projects in the clinical setting. Currently, Ohio State neurologists provide telestroke coverage to our three emergency departments here in Jackson, Gallia, and Pomeroy. For the last year, we have collaborated to create a tele-ICU program at our hospital in Gallia, which has been a great success in allowing us to continue to care for critically ill patients locally. So when we were asked to provide a location in Southeast Ohio for the statewide project, we proudly said yes. Although I'm not sure if anyone has ever told Dr. Thomas no. At this time, I would like to introduce Dr. Andy Thomas, Chief Clinical Officer for The Ohio State University. Andy's been a great friend and supporter of Holzer, and has also been an invaluable resource to me through the years. So thank you, Andy. Dr. Andy Thomas.
Good morning, everyone. Before I take a chance to make some remarks, I actually want to introduce someone who frankly needs no introduction in this community, and that's Alan Stockmeister, to make some remarks. Many of you know Alan. He is a member of our University Board of Trustees, currently serving as Vice Chair, also a member of our Medical Center board for the Wexner Medical Center, and actually chairs our Quality and Professional Affairs Committee, so we have a chance to be together every month at those meetings. But he's obviously incredibly well known here as really a foundation of the Jackson community. And along with his service to the Ohio State University, has a long history of service to Holzer as chair of the board and chair of the board here at Holzer Jackson. So Alan, please come forward and make some comments.
Welcome, everyone. Especially if you're not from Appalachia, Ohio, or Jackson, all this community. Really enjoy having you here. Take a look at our hills, our weather. Hey, sometimes it's better than Columbus. But as a lifelong resident of Jackson, I'm proud to be here to help commemorate the arrival of the SOAR unit. It's a mobile unit, MRI, and it's for all of our communities in Appalachia, Ohio. So we have to get the word out, not to just Jackson County, but also down to Scioto County and Athens. And I see Jay Edwards here. Jay, you got to help us with that. There he is over there. Meigs, Vinton, there we go. We got them all. But Holzer Center right here in Jackson is the perfect partner to help advance this important work. The hospital is at the heart of the community and will provide a place for residents to participate in the study and be connected to resources to help them succeed in life. As a member of the Ohio State University Board of Trustees, serving as Vice Chair, and as well as the Ohio State Medical Center Board And as former chairman of Holzer Health System, I spent 26 years with Holzer. I know that their deep commitment, all of our deep commitment, to address and support the ambitious goals of what this research can do and how we conduct it. I'd like to acknowledge that the SOAR study would be not possible if it was not for the support of Governor Mike DeWine, his cabinet, the Ohio Department of Mental Health and Addiction Services, and we are grateful. We should all be grateful for that support. So, Dr. Thomas.
Thank you, Alan. He did reassure me that the weather is always this nice in Jackson. I want to make a couple comments about the SOAR study. You're going to hear from Scott Langenecker later in the program to get more detailed. But really, I like to think of a project like this as our land grant mission coming to life and coming to your community, where we can partner together on a lot of the things Rod talked about with our clinical care. We can certainly work. We have a group of Holzer physicians coming up actually tomorrow for the first session of a leadership development program, so on the education side. But to do this in research, I think is really, really meaningful. The SOAR program is not just Ohio State, though. It's headquartered at Ohio State, but there are more than a dozen academic and health science universities around the state that are partnering with us. In fact, a number of us will be over in Athens at OU later today for our third SOAR symposium of the team that's really working across the state to make this project a success. I want to take a second and thank Lawan Fawn, who's here. Dr. Fawn is our chair of psychiatry, and really this project is to a large part inspired by your work and your thoughts. Not on the program today, but just that he is a wonderful, unique individual, and we're proud to have him here at Ohio State. So what is SOAR? SOAR is across all 88 counties of the state with two key projects. First is to do a survey of up to 15,000 Ohioans looking at not just what are the causes of mental illness, but looking at what are the things that help some people become resilient. Why do people living on the same street in the same community? One individual has issues with depression, substance use, addiction, potentially overdose or suicide, and another person living in that same block finishes school, gets a job, starts a family, contributes to their community. So we've really modeled this after the Framingham Heart Study that some of you may be familiar with up in the late 1940s in Framingham, Massachusetts. They started studying an entire cohort of patients to figure out why do people have heart attacks. Much of what we know today about what will both cause a heart attack, but what can prevent a heart attack, has been learned out of the Framingham Heart Study. And our goal across the state of Ohio, metro, urban, suburban, rural Appalachia, to look across our entire population to figure out what are those factors that we can do and that we can enforce, interventions we can do that will really prevent mental illness and ensure resilience in our population. So it's a really exciting opportunity. The MRI that's here is a part of, beyond the survey, a deep brain health study that Scott will go into more detail on that includes brain imaging, genetics, bioassays, other markers that can help us understand mental illness to a greater degree. I'd also like to take a chance to thank the DeWine administration and specifically the Ohio Department of Mental Health and Addiction Services for their support of this work. I'll take a second to recognize Nikki Reese, who's in the back, who's one of the leaders at the Ohio Department of Mental Health and Addiction Services, for being here today. Also, as Alan did, I'd like to recognize Jay Edwards, 94th Ohio House District, and thank you for all of your support over time of this project and for being here today. Unfortunately, Speaker Stevens was not able to be here today. However, he did send this very nice commendation on behalf of the Ohio House of Representatives. They'll be over here on the side table if you want to take a peek at it. We really appreciate the support of the Speaker and that resolution. Thank you. Last, I would like to really thank the person sitting next to me in the front row, Amy Shadwick. She's been at the table for a lot of our work and our relationships with the state. Amy is the director of Governor DeWine's Recovery Ohio program, and I'd like to invite her to the podium to make some remarks.
Thank you, Dr. Thomas. It's really an honor to be here in Jackson for such a significant event. I actually started my life as an Appalachian resident born in Jefferson County, moved away when I was about 15, but very near to be here in an Appalachian community and seeing how we can all work together to support all Ohioans. So as you all know, Governor DeWine is deeply committed to improving mental health and addressing substance use across our entire state. So since the beginning of his administration in 2019, he prioritized these initiatives by establishing the Recovery Ohio Initiative, as Dr. Thomas said, which I have the privilege to serve as the director. Recovery Ohio's mission is clear. It's to bring together all our state agencies and community partners in a unified effort to tackle Ohio's mental health and substance use crisis. Collaboration is at the heart of our approach, and today is a perfect display of what that collaboration looks like. So let me share a few sobering statistics with you that highlight the urgency of our work together. When I talk about these numbers, remember, they're not just numbers, they're not just stats. There are mothers, fathers, sisters, brothers, neighbors. So it really underscores the importance of the work that we're doing together. 1 in 5 Ohioans experienced a substance use disorder in the past year. Nearly 5,000 Ohioans lost their life to an overdose in 2022. 1,797 Ohioans died by suicide in 2022, and approximately 2.2 million Ohioans have lived with a mental illness in the past year. This crisis also extends far beyond Ohio. Nationally, the CDC reported almost 108,000 drug overdose in 2023. And the CDC also noted that suicide rates have surged by 36% between 2000 and 2022. So these statistics underscore that this is a national crisis, but they also reveal the close relationship between substance use disorders and mental health struggles. The reality is, many of us know someone who is managing these challenges. These are not isolated incidents, they affect families and communities as a whole. In Ohio, we are here to take decisive action. That's why we've committed $20 million through the Ohio Department of Mental Health and Addiction Services to the SOAR Study, a groundbreaking effort to dig deep into the roots of mental health issues. The SOAR Study represents more than just research. It's a commitment to ending the stigma that too often prevents individuals from seeking the help they need. Through SOAR, Ohio will set the standard by helping residents overcome mental health challenges, enabling them to stay in the workforce, complete their education, support their families, and contribute meaningfully to all of our communities. Ohio is the ideal place of a study of this magnitude. I'm excited about the transformational change and the lives that will be saved as a result of the SOAR findings. It's now my pleasure to introduce Dr. Tracy Schwab, Dean of the Heritage College of Osteopathic Medicine at Ohio University. Wanted to make sure I got that all right. Dr. Schwab and her team are training the next generation of medical professionals who will one day apply the lessons learned from the SOAR study to improve treatment and prevention efforts across the state and ultimately change and save more lives. Dr. Schwab.
Thank you very much, and thank you for inviting me here. Today's ribbon cutting ceremony is really momentous when representatives from so many different groups come together in person to talk about an issue of critical importance to the health and well-being of Ohioans. Many of us here are already involved in some ways with finding methods to address mental health issues because we see the stigma. We see the barriers that make it challenging to treat mental health conditions, especially in the Appalachian region, where the suicide rate is 17% higher than the national rate. We know somebody personally that's living with this or has experienced these mental health issues. Mental illness can affect any of us. Not even our health care and our frontline physicians are immune to this. Anxiety, depression, and suicide, burnout are common among physicians. The depression rate among medical students alone and medical residents is 29%, so a third of them, almost a third. And the suicide rate for residents is twice that of the general population. Physicians, like others, often worry about the stigma, about appearing weak, or being shamed for their mental health issues. As a medical school, the Heritage College is committed to understanding that our students may experience issues like this and psychological distress. So we want to be able to partner with them and take care of them. We prioritize support, counseling, and other resources to help students learn to become more resilient, how to balance their well-being in their lives. Our mission is to educate students, and our students' mental health is just as critical as their physical health to their success. We not only treat mental illness, but we also need to address the social determinants of health that impact mental health, like housing, food insecurity, education, and employment. And that work truly takes a village. Our college's Family Navigator program through our community health programs is this, where they connect with Medicaid-eligible pregnant women to provide them wraparound services that will help them ensure a healthy pregnancy and birth. These services range from getting housing to treatment of substance use disorders, smoking cessation, to mental health support. Our Navigator program is a perfect example of what it means to build partnerships to improve the health of our communities. At Ohio University, we continually seek partnerships in our efforts to meet our educational mission and our commitment to the people of Ohio. One of the ways we've been doing that is through our Ohio University Health Collaborative. The collaborative has partnered with more than 45 state and local organizations on workforce development efforts, public health research projects, and more. So OU brings that sense of collaboration to the SOAR studies, combining our expertise, our perspectives and resources with other academic research universities, and partnering with the state to fundamentally understand and curb mental illness is truly an ambitious and worthwhile endeavor. Through the power of partnerships, collectively, we can better understand the factors that influence and affect mental illness that will have an impact on all Ohioans for generations to come. So while our organizational missions may differ slightly, we share a responsibility to our communities. As we know from experience, that we can do more together to help Ohioans lead healthier lives than we can do in isolation. So I'd like to bring up our next speaker, who exemplifies why the SOAR study is so vital. Melissa Plummer is a certified drug counselor in our region, helping youth in the area with substance use disorder and mental health disorders. But before she became a counselor, she also lived with substance use disorder and mental health challenges. So Melissa, please come share your story with us.
Thank you, Dr. Schwab, and thank you all for being here today. Again, my name is Melissa Plummer. I'm 44 years old, and I have been in recovery for 13 years. Thank you. My substance use started when I was in high school when I was involved in a car accident. I was prescribed Percocet. I developed a habit pretty quickly, but I was able to break that addiction. But then I found myself hanging out with someone who was an active user. That relationship was toxic from the beginning. Our relationship was revolved around drugs. We have had done everything from marijuana, bath salts, meth, cocaine, and eventually I even started injecting opioids into my body. This disease makes you do the unimaginable to the people that you love and care about. I stole from my family to support my addiction. I lost custody of my children. I ended up in and out of jail and eventually landed in prison. Prison is actually what made me realize this is not who I am. This is not what I want to be in life. I had months to think about what I had done in my life and how to get past that and how to make a change. To think what had happened in my life had led me to where I was, I did realize that it wasn't for me. Then there, I chose to be a mother, a better sister, a better daughter, a better granddaughter. The one thing about this disease is that it's a mental illness and substance use often go hand in hand. We tend to mask our mental health by using drugs. Another thing I'd like to point out is that drugs do not discriminate. They don't care if you're white, they don't care if you're black, they don't care if you're female, they don't care if you're male. They don't care if you're rich or poor. They will latch onto you at your most vulnerable time in your life. With this short version of my incredible journey, I am happy to say the past 13 years have been rewarding. I have my children back, and I'm a better mom. I am married, and I have a wonderful husband, and we have made a wonderful home. People ask what gave me the resilience to get through my addiction, and all I can say is that I couldn't have done it without my supportive family, which one of my sisters is here today, my aunt by choice. And without them, I really wouldn't be here today. I'd like to add the long-term research that is happening with the SOAR study will help future generations. We didn't discuss mental health or substance use disorders when I was growing up. Studies like this can change all of that. Thank you for letting me share my story. Now I'd like to have Dr. Scott Longenecker, Department of Psychiatry and Behavioral Health at the Ohio State University College of Medicine, give us more information on the SOAR study and what their researches are.
Thank you all for coming today. I want to give a couple shout outs before my comments begin. At the very back, there are 3 of our SOAR team members that I hope you all get a chance to meet. They're the folks who are running the MRIs and the EEGs and the neuropsych testing. What I wanted to do, sorry, I got a little verklempt there. That's a word my mother taught me. Thanks for sharing that personal story, Melissa. That's why we're here, is we're here to learn all of these personal stories of recovery and resilience and how we might actually marshal that information to build a better tomorrow for our Ohioans. Every one of these stories has clues to what we can do on a broader level to build communities, workplaces, educational settings, and faith communities that can bring mental health to the fore in how we care for each other. You've all heard the bad news, right? Ohio is in the midst of what's going on in much of our country. The opiate crisis is real, and we're not ahead of it. We're trying really hard, but we're not quite there yet. And suicide deaths are still, going in the wrong direction. But we have everything we need right here to turn that tide, because we are a proud state. We are a state that leads, and we have in our DNA, our very DNA, all the clues and all of the solutions that we need to move forward. I want to acknowledge something that we forget. When we talk about a problem, sometimes we forget about all of the people who are working hard right now to make this a great place and a great place for families to live in. So I want to thank our governor, our legislature. I want to thank the Ohio Moss folks. I want to thank Director Shadwick of One Ohio in Recovery. I want to thank the Holzer team here. I want to ask you a very personal question, like why are you here? I know why I'm here. I'm a father, I'm a son, I'm a patient. I have lots of reasons to be here. And I know that we all bring important reasons why we're here and why we think this is important. And so I'd like to take a moment, have a moment of silence to recognize all the folks that we've lost in this fight to addiction and to suicide, and to folks who are struggling right now. Thank you. We are all ambassadors on this journey for our commitment, our movement, our coalition. Our movement to reduce stigma for mental health and addictions. Our movement to bring effective practices and treatments to build health and resilience. Our movement to understand old
and to discover new pathways to resilience. To improve mental health across the state, we will marshal this unwavering commitment of who we are as a state and as a people, from the state of Ohio and to communities, all of you. As described earlier, our State of Ohio Adversity and Resilience Study was really born out of a conversation that the governor had with my chair, Dr. Fawn, and I want to thank Dr. Fawn for his vision in building this together. And it's actually emerged out of many conversations over the last several years. The study aims to transform the way that we think about, the way that we talk about, and the way that we address mental health and addictions challenges in our state. To do so in partnership with many different effective healthcare advocates, substance use disorder specialists, those who are in suicide prevention and crisis work, those who do treatment, those who are in recovery, all of our practices, services, and supports, including our families, our faith communities, our educational systems. We can all work together to do this. And we want to understand pathways to resilience, the ability to adapt and to grow in the face of adversity. Basically, why does one person have the coping skills to manage adversity and another one struggles? Even with the same family, even with the same community, even with the same school. What are these factors that are relevant for families? What are the factors that are relevant for communities, workplaces, educational settings? And perhaps most importantly, understanding ways that people can change directions. We are not rock. We are clay. We are moldable. We are capable of being plastic and learning new things. And that is our superpower. That is what we can do to build resilience within ourselves, within our families, and within our communities. And that secret is in plain sight. But that doesn't mean that the work is easy. If it was easy, we wouldn't be here. And I want to acknowledge, as I did before, all of the people who have been working in this space for a very long time to help our communities and our families live meaningful and rich lives. So we're standing in the shadow of a state-of-the-art MRI trailer. We have electrical encephalography tools. We have questionnaires. We have your phone. We have blood sample markers. All of these are tools, modern tools that we can use to listen and learn. But that's just the beginning. Once we listen and learn, then we move to partner. Then we move to innovate. Then we move to transform what we're doing, both in a healthcare setting here at Holzer, but also in the school, in the home, in our communities. So this study has two elements. There's a big, broad survey that goes out to 15,000 or 300,000 Ohio families, 15,000 of which we hope to have respond. And I would say in Southern Appalachia already, I can give you updates to this morning. We are at 88% of our target goal for surveys completed in South Appalachia. So when people are getting these postcards in the mail about how they can actually answer questions about mental health and addictions to help themselves and their neighbors, they're in. They get it. They understand why we're here and what we're doing. In addition to that study, we also have the brain health study, which marshals the technologies that we have to understand how the individual, but also the individual nested within a family, actually moves towards risk or maybe moves towards resilience. And of course, we all want more people to move towards resilience. And we use these tools not just, as Andy was mentioning, not just at Ohio State, not just at Holzer. We have partners all around the state, including Ohio University, including our big universities and our small universities. Almost every public university in Ohio is involved. And we are continually, gradually adding more behavioral health providers and hospitals. So what do we actually do with these tools? What are we trying to understand? We're trying to understand how individual people, the brains of folks, respond to stressors. We try to understand how their immune system responds to stressors. We look at how blood flow in the brain changes in reaction and response to losses and to successes. And all of that is the pieces that we can use to put together to learn things that we don't know yet about how to build and move towards resilience. And that study already has over 500 people enrolled. And we hope, with your help, to enroll over 400 people here in Jackson over the next few months. From Waverly, from Portsmouth, from Athens, from Ironton, Chillicothe, Pomeroy, and more places nearby. So we need your help to get the word out. This is a fact-finding mission, as I alluded to before, to listen, to learn. But then, once we listen and we learn, as Director Harris and I were talking about, what's next? The outcome is actually what we're interested in. This is what Dr. Fawn and Dr. DeWine began with, which is how do we bend the curve? How do we change the storyline? How do we be that bold, bright, brilliant Ohio that we know we are and lead in this challenge? So let me talk about where we're headed. We will build this cohort of families. We want to retain this cohort of families, and that's about 200 folks around Jackson. Anyone can participate. Doesn't matter whether you've experienced adversities big and small, or if you're lucky enough, none at all, to feel like you're resilient or not. All people from all walks of life are welcome to participate, and we welcome you to be a partner in this process. So please do spread the word. We plan to come back often. We plan to continue to have conversations with the folks here doing the work every day, as often as we can. And as we've already noted, this is a statewide initiative. So the folks who are doing the work are a part of this coalition. So our hope is that all this work over the course of multiple years will accelerate the pace to strengthen, develop, tailor, and implement new discoveries for building resilience in Southeast Ohio, and ultimately the globe. And Ohio has been, can be, and should be a leader in this space. So not only can we solve the problems that are in front of us, we can take our bold leadership and we can innovate, and we could take things that we learn and develop here and export them to other places within the country and in the world, in the healthcare space. So let's commit to working together. And this is my ask for you. Talk with your families about participating. Talk with your leaders, elected, educational, faith, including those here, about sustaining our Ohio commitment to SOAR and what SOAR stands for. And what does SOAR stand for? SOAR is a promise to our children. SOAR is a promise to our children that when you have a challenge, we have a system of supports to actually help you through adversity to live a better life with meaning, with connection, and with purpose, so that they can really lay out the possibilities for their dreams and their futures. And that's all from me. Thank you all for coming today, and I think we have a ribbon to cut.
Do it on 3. 1, 2, 3. Woo!